means we're about to get started here with the health sharing question and answer version webinar. I really appreciate all of you guys being here and just to continue to learn even deeper about the better alternative to health insurance. You learned last week that is health sharing. Your curiosity to find a better way, your willingness to learn, and your frustrations. The frustrations of premium increases being completely out of your control are all reasons you're here joining us this afternoon. Now, in the next 30 minutes, we'll be answering the most frequently asked questions, as well as all of your questions that are continuing to come in the chat panel about health sharing. Today's hosts and your primary educators, Russ Morgan and Joey Murray, are industry leaders who are committed to finding, studying, and becoming experts in better alternatives to traditional thinking. If they're not teaching at cash flow mastermind groups, Joey and Russ can be found challenging their clients thinking in all things cash flow, and in return are considered as trusted cash flow strategists, brilliant, innovative minds, and really just the idea guys. They both practice what they preach in everything they do and truly believe that one cannot ask enough questions before committing to any given strategy. So continue those questions in the chat pane, and Joey and Russ, welcome to the call.
Guys, can you just imagine for just a minute what it would feel like to get that notice in the mail that says your premium is either going up to $2,000 a month for your family of two, or you have to make less money to qualify for our $200 a month Obamacare option? That's real life, guys. This is what happened this morning. I was talking with Susan, and this was for real. Susan said, Joey, I have to either choose to make less in my real estate business this year. I can't make more than $50,000 this year, or I'm going to be forced into this Blue Cross plan of $2,000 a month. And I just said, Susan, there are options. And have you heard of this health sharing option? She was incredibly relieved to know that there was something better that would not incentivize her to make less money. You can imagine, though, she had a lot more questions than just that. And so that is why today we have come with more of those answers for your questions. We brought in some of the experts and professionals in this area, and she mentioned to me right as we left, Joey, how can you help me?
Well, Joey, I imagine one of the things that she's going to ask you, if she didn't already, is if I am a cash paying patient, shouldn't I be saving this money? And I know that's the question I get most asked. Being in the financial business is, where do we put the money? And those are going to be the things we're going to have to cover in a later webinar. But the reason we're here is we're talking about cash flows. We're talking about the ways that we've got to control more of our money, and health sharing is one of those areas that can put $500, $600, $700 a month into our pocket, but we've got to have a place to put it. It's going to have to be safe. We're going to have to be able to access it. Otherwise, we're going to fall into other traps. So in our next webinar, I want to make sure we cover that, because I know we're going to have questions for those. But for today, health sharing. What is it? What are some of the big questions that we have? So we're going to bring on Matt. You on the phone? Matt, can you hear me?
Yeah, I'm here. Can you hear me?
I have Matt Davis, an orthopedic surgeon here in Birmingham. Matt started actually implementing a cash patient business about almost 8 years ago. He, as a physician, has taken it upon himself to actually put his prices on his website so you know what you're going to pay for when you go. But also, having a large family, Matt's had many expenses in which he personally has had to go to the doctor and pay things out of pocket. So I think he's going to be a great advocate and someone we can ask questions of today. In addition, we have
also Jamie Piles is joining us. He's a former Samaritan Ministries board member. He is also obviously very much a health sharing member himself. He travels the country. He teaches large groups about health sharing and Samaritan Ministries. and he currently resides in Oregon. Jamie, are you on the call?
I'm here.
All right,
Awesome.
perfect.
Thank you for joining us, Jamie.
Well, guys, I'm going to throw out the first question because this is one that I got just the other day, and I would like maybe just to start with you, Matt, from a physician standpoint. If I call your office and I want to come see you for a problem, and I tell you that I don't have health insurance, that I'm actually a health sharing member, how does your office handle that?
Well, this is a issue that we have recognized that a lot of people struggle with, and it's gotten more and more commonplace over the last probably 3 to 4 years. But I've made sure that my staff know what I charge for the most common services that I provide in my office. So when somebody calls and says, what does it cost to come in and see the doctor, they can give them a price right over the phone. Most doctors' offices struggle with that question because they kind of waffle. They're like, well, we don't really know what the doctor's going to charge for until after he sees you. And I've just tried to remove some of that confusion by just basically making a set price. So a new patient pays one fee, and someone who's already been a patient in the past that's just coming back either for a follow-up of the same problem or for a new problem, there's a fee for that. And then if I do an x-ray or an injection or something like that, then my staff knows how much I charge for those services as well. So, you can't give anybody, it's just like calling the carpet guy or the plumber or an electrician. They can't give you a quote over the phone, but they can tell you what it costs for them to come look at it. And then once they know what's going on, then you can kind of come up with a better idea of what you're looking at from a cost standpoint. But for the initial evaluation, my staff can tell people on the phone.
Awesome. Thanks, Matt. I have the next question actually here for Jamie. Jamie, some questions come back concerning PPOs and how to choose doctors and whatever with Samaritan. How does that work with Samaritan? Do people get to choose their doctor, or is the PPO involved?
Okay, that's a great question. That is something our members actually really love about our philosophy at Samaritan. We think Christian families should be empowered to make all the decisions about their own health care and not be told where they have to go and what kind they have to get. And that includes a lot of alternative medicine. And so because we help our members pay cash promptly enough, then with very little exception, most of our members are literally able to choose the place they want to go for their health care almost worldwide. Did you ask me about what are the share amounts as well?
We're just mainly wondering about the choice of doctors.
Okay. Yep. Yeah. We don't think you should have to be limited to a network of low bidders, and we don't think you should have to give up control of the health care.
Hey guys, I've actually just got a question in online asking about, and excuse me for jumping in, but asking about prescription medication for. How does that work, Jamie? Can you answer anything about prescription medication? Or Matt, maybe you can follow up with that, how you've seen patients leave your office and get prescription medication?
Okay. That's a very good question, and it is certainly a factor we want people to understand. At Samaritan, we share for all prescription medicines in the short term that are incident related. So if they need antibiotics, they need painkillers related to surgery, anything like that, that's all part of what we share for, but we limit it to 4 months. So that means that they're on long-term prescriptions. Those are things that we actually don't share for out past that 4-month mark. We do have a relationship with several discount organizations that our members are claiming to save as much as 50–60% on some of the medicine in that area. If you're able to search prescription solutions with cash on the open market, there are times when you're able to find pretty favorable solutions for that.
Thank you, Jamie.
So I'll follow up on that. That's, as a physician, I write prescriptions for patients all the time, and one of the things that I have found to be very useful is a free website and free app called GoodRx.com, and there are others that are similar in nature, but I've found that one is just particularly easy to use. In my office, I have computers in the exam rooms, and so when I'm getting ready to write a patient a prescription, I can pull up GoodRx website, I can put in the patient's zip code and the prescription that I'm writing, and it will survey local pharmacies and display what the cash price is for those prescriptions. And so I can tell the patient, you know, here's what I think you need. If you go to this pharmacy, it's going to cost you this much, or you can go to that pharmacy and it's going to cost you that much. Do you care where I send it? And sometimes they'll pick the closest one to their house. Sometimes they'll pick the cheapest one. Sometimes there's a big difference between one or two pharmacies, and sometimes they're all in the ballpark of the same thing. Or if it's something that none of them are very affordable, then I, as the doctor, have the opportunity right then to say, well, you know what, that's really not worth spending that kind of money on. Let me write you a different prescription instead. And that whole process probably takes me about 30 seconds to do.
Here's a question that just came into us. How long does it take usually for you to be reimbursed?
You're talking about me as a physician?
I'm speaking of as a health sharing member, how long would it take me to be reimbursed after filing a need?
Okay, I assume that was to me, Jamie. Depending on the time of the month when you return those bills into us, you submit a need, we walk you through it, we help you understand it, you enter your bills on a need processing form and send them in to us. You're either going to get that completely shared and back to you within 30 to 45 days, or possibly 60 to 75 days on the very outside. That's the longest it would go from the time we receive those bills. We share those the very next month, but we have a cutoff date that's in the 15th of the month, and so that's why those two numbers vary.
Matt, you have experience in that too. I mean, personally, you've had a lot of things. Would you add anything to that?
Yeah, no, I think that time frame is dead on. I mean, we've had 2 children that were born while we were members of Samaritan, and you know, the total bill for all that care was, you know, more than $10,000, and we got all of our funds back. I think one was, you know, 2.5 months, and the other one was maybe a little closer to 3 months. But it was, it's not a long, drawn-out process. The hardest thing is just getting all your paperwork in order, getting, you know, the paperwork that you need from the doctor's office and the lab and the radiology centers and all that sort of stuff. But once you have all that in hand and send it in, the actual mechanics of how the system works are pretty efficient.
You know, I know personally it's the idea of doing something completely different than what everybody else is doing is what maybe prevented me from doing it even sooner than I did. But I know one of the common questions that we're seeing today, and I've had probably asked me every time I've talked about this, what happens with like the catastrophic situation? What is your response? Okay. I'll let you start, Jamie, and then I'll let you respond to that, Matt, too, as a physician.
Extremely common question, and we have a fantastic answer for it. We begin sharing when our members have a medical incident that goes over $300. So any incidents of less than 300, members take care of that themselves. And when it goes over 300, then we share 100% of that up to a limit of $250,000 in our basic plan. There's no limit on the number of incidents our members can have, but in the basic plan, there's a limit of $250,000. And so about half our members seem to be comfortable with that, and the other half go ahead and join an additional optional subgroup that we have that's called Save to Share, and the people that are in that group share any need that goes over $250,000 on up to pretty much whatever. And it's extremely affordable situation the way we have it. Any family that wants to be in that additional group, we simply ask them to set aside a very affordable amount of money once a year, and then we ask them to share it in small amounts when it's needed, when we actually have those larger needs. And those amounts are very affordable. For a single membership, it's $133 a year, and for a 2-person, it's $266, and for a family of 3 or more, no matter how large, it's $399 per year. And to our knowledge at this point, no family's ever had to share more than about half of that so far in any one year. And we track that fund even though we don't get our hands on it. Our members are just holding it. And right now there's $17 million in that fund ready to be shared at a moment's notice for a Save to Share need that went over $250,000. And every Save to Share need that we've ever had has been totally met and shared. So it's working extremely well. Our head guy owns the cattle on 1,000 hills, and the price of beef is always good. So we just share it. A lot of people assume we would go out and buy an umbrella or something, but we just share it, and our members are holding that money, and it's working fantastic.
Yeah, I've been a member for 4 or 5 years now, and I can only recall one instance off the top of my head where I was asked to send in that additional share amount above and beyond my normal monthly share. So it's not something that happens very frequently. And $250,000 is a lot of money for a routine care. I mean, I can share experience with. I have several patients that I see that use Samaritan and some of these other organizations, and one of them was sharing with me that one of his family members had a heart attack. Called 911. The ambulance came, picked him up. They took him to the ER. He had, went to the cath lab, had a stent, ended up being in the hospital for, ICU for several days. Total hospital bill was in the ballpark of $100,000. To me, that's catastrophic. That's an unexpected, life-threatening, very expensive ordeal. And he said within 3 months, the whole bill was paid off. So it worked as planned in that situation. So I mean, when you talk about catastrophic coverage, what are you talking about? Car accidents, heart attacks, cancer. I mean, all of those things are going to be in that, less than $250,000 ballpark, unless you're, in the ICU for 6 months in a coma. It's unlikely that you're going to spend more than $250,000 on medical care.
Wow, guys, thank you for that. We have several more questions coming in. One that kind of continues to be asked of us even throughout this last week was just comparing the different sharing groups. And so, Jamie, I'd like for you, if you don't mind, just kind of speak a little bit to how Samaritan compares to some of the other sharing groups. What are some of the key components there?
Okay, I'll be happy to do that. I would encourage people to not simply make the quick conclusion that we're pretty much all the same. There are some very significant differences. We do serve the same niche, and we share the same exemption clause in the Affordable Care Act that says our members don't have to pay the penalty. The other healthcare sharing organizations out there, whether it be Medi-Share or Christian Healthcare Ministries, they are more like an insurance company, and I don't mean that critically. It's just the way it is. They make you choose a deductible level. They make you give them the money. You have to wait for them to pay the bills, and most of them have networks that they would like you to participate with. We're different in every one of those. Our members actually get the privilege of sending their share amount directly to a family with a need every month, as we're told to bear one another's burdens, and we include cards of encouragement and a commitment to pray for that family each month. Our members get to choose any doctor they want to, and we just have that one plan. We start sharing when our members have a need goes over $300. We feel like at Samaritan we operate from a little bit more conservative philosophy, and again, I don't mean that critical, but both of the other ones will require their members to sign up for Medicaid if they're ever qualified, and we don't do that. And they also require their members to sign up for Medicare when they turn 65 if they want to continue, and we don't do that as well. We also allow people to opt out of Medicare if that's something they were to choose to do, which a few people do actually do that, and that way they don't give up control of what kind of health care they want to get. So there are some very significant differences. That direct share model is something our members really grow to love. You could probably imagine if you're dealing with something really difficult in your family and you're being encouraged by hundreds of families with cards and knowledge of they're praying for you while they're paying the entire bill. It's a pretty amazing process. I think it's what Paul had in mind when he told us we're to bear one another's burdens to fulfill the law of Christ.
I couldn't agree more. And man, I know we've had discussions about that too, and even have wondered at some point, where are things going to be going from a physician standpoint when we're dictated by Medicare or other government or insurance carriers. Would you like to speak to that? Because you're seeing that on the front lines as a physician.
Oh yeah, absolutely. I live with that every day, and philosophically, I'll be clear and upfront. I am a member of Samaritan Ministries. I accept patients that have those other group coverage plans. But when I was looking at those different options, several distinctions immediately came to mind. And as a physician, one of the things that is frustrating for me and my staff is all of the different rules that we have to abide by, all the different claims requirements and, requests for supporting documentation and all that sort of stuff. And so looking at it from that side, when I saw that, some of these organizations basically run more like a insurance plan where I have to deal with them to get paid, that was not very appealing to me. And the fact that, with Samaritan, I, as a physician, am dealing directly one-on-one with the patient that's in front of me. And I can tell them what I think that they need, and they can decide if they want to do that. And then we can talk about what that's going to cost. And we agree between the two of us right there in the exam room. And then once we've come up with an agreed plan, then we move forward. And there's nobody else that comes along to question that or, start haggling with, for a discount or anything like that. That gives me a lot of peace of mind as a provider that my patient's on board and that we've agreed to something and we can move forward without any reservations. And so I personally was more drawn to the Samaritan's philosophy when it came to that structure. But then also philosophically, like Jamie said, the other organizations want you and encourage you. I didn't realize that they even sometimes may require you to participate with government plans that you are eligible for. Well, my perspective is the government doesn't have any role in healthcare, and so I don't think a group should require that you get on government healthcare to be a member. So I don't want to participate in that sort of organization.
Great, thank you, Matt. And guys, we've got actually a lot of questions comparing different companies. If y'all want on the webinar, go to the handouts portion of the frame, and there will be a PDF that you guys can download that has 3 different companies with a few different major comparisons of those. Joey, do you want to answer this last question that we just got fielded?
Yeah, so some folks are really asking the question about, okay, now that there's a new president in place, new government in place to a certain degree, how does that unravel what the mess Obamacare has caused, or how quickly could something like this take shape?
Well, from what I've already come across, because that's something that I'm, keenly sensitive to, because it's what I do every day and it's my livelihood. Everything that I've seen shows that they do not anticipate anything to really change in 2017. That anything that happens is going to take some time to agree on a plan, to vote on anything, and then to implement it. And part of the criticism for some of the things that have gone on in the past is that these artificial deadlines were created and they didn't give the people in the industry, whether it's the insurance carriers or the hospitals or the physicians, they didn't give them time to plan and prepare for these sort of things. So I think going forward, they will probably make more out on the horizon changes and deadlines, so there's not going to be any rapid changes as far as I would anticipate.
This is Jamie. From Samaritan's perspective, there's obviously a huge amount of unknown. No one knows what it's going to look like. There are 2 factors that we obviously are concerned about and pray about. One is that we simply pray that whatever they do, we will still be allowed to do what it is we do. What we do is very simple, and we were able to get the exemption clause written in not because they decided we're an insurance company, but basically because they decided we're a part of the solution. We're not a part of the problem. We take our kids to the doctor and we pay our bills. And so obviously obviously we're praying that whatever it is they do, we'll still be allowed to do what we do, and we'll leave that up to the Lord. The one other factor that could come in, we at Samaritan have felt that all Americans should be able to use HSAs, and as it currently stands, the Affordable Care Act makes it very clear that that can only be done in conjunction with a high deductible health insurance policy, which we are not. So we had actually written an exemption clause that had been sponsored by more than 150 legislators. We were hoping it would get on a bill and voted on someday. It's our understanding that our current president-elect is including that as one of the possible changes that all Americans may be able to do that. So that will be an encouraging thing for us.
Guys, thank you so much for just being with us today and all the work that you guys are doing. Being here to answer these very, very important questions for the folks on our call today is just, it's invaluable. And so I'm very grateful for you guys to be with us. So folks, hopefully you can see that really healthcare, health sharing is really the tip of the iceberg as it relates to cash flow that is going away from us. This is something that we identify every day with our clients, and this is just one aspect of it. So if you guys have any question in your mind that maybe these guys have some knowledge of some other cash flows that may be going on unnecessarily in my family, in my business, then we want to invite you to our follow-up webinar. Just make sure to tune in on that.
And Joey, and I'll follow up with one other comment. You know, the HSA option, I think is certainly a good one. What I don't see happening in the near future is deductibles coming down anytime soon. I think this trend towards high deductible plans has gotten a lot of traction in the insurance industry. This first dollar coverage, $100 deductibles really set the stage for people overutilizing healthcare. When it doesn't cost you that much to go into the doctor, it's easy to go in for every little thing. And I think the insurance companies have seen the truth of that in how things have shifted with these high deductible plans. So whether you continue to use a health insurance plan, whether it's Blue Cross, Aetna, Cigna, whoever it might be, or if you want to move towards a health sharing program, I think the reality is that paying for your medical care at the time of service is something that people need to mentally prepare for, as well as financially prepare for. You know, one of the beauties that I see when I see a patient that's coming in that I know is covered with Samaritan, I know that they're going to pay me that day and I don't have any more paperwork to do. I don't have to worry about anything. But sometimes we do run into some difficulties when that person needs to have surgery. And now we go from, you know, $100, $200 bill to maybe a couple $1,000 bill. And sometimes people don't have that kind of money available to them, so that then now we have a little bit of a juggling act. Are we going to postpone the surgery so they can pay for it ahead of time, or are we going to extend them, you know, a somewhat of a line of credit, so that, because I know how Samaritan works and how the others work, it's going to take 90 days to get all those funds in. If you have an opportunity to save money so that then you can go and get the care that you need, and you can tell that doctor on the front end, I'm going to pay you today, whether it's $100 for an office visit or $500 for an MRI or $3,000 for an outpatient surgery. If you've got those funds available and ready at hand, then you are in the driver's seat when it comes to making those decisions. You're not at the mercy of somebody else's mercy or graciousness or line of credit or whatever. And I think that's one of the things that Russ has opened my eyes to over the last few years, is that, you know, anything that you can do to empower yourself financially is going to make other aspects of your life easier and less stressful to deal with.
Well, Matt, thank you so much. And if you want to look further, you can go onto Matt's website, look him up at Davis Orthopedics. And thank you, Jamie. Samaritan Ministries is a wonderful health sharing group, and as Jamie has expressed, are not the same as everyone else. And so I encourage you to go to Samaritan Ministries and look their plan up and just see how these plans may work for you. And I encourage you for the next time, as Matt said, we are going to be covering where we tell people to save money, and as Joey said, that this is really just the tip of the iceberg as it relates to dollars that are flowing out of our control. And thank you for all joining us. Have a great day.